Well, it can be difficult for men to talk with their doctor about erectile dysfunction, but the consequences of avoiding that conversation can be dire. Dr. Awane is a urologist with Lake Area Medical Center, and he's joining us with some important information about this topic that guys just don't want to talk about, do they?
That's true.
Yeah, but we need to have that conversation because it really is a problem that's pretty common, right?
It's very common. Actually, there are about 30 million American men who are reported to have dealing with problems with erections.
Okay.
And that number is expected to increase.
Is it mostly older guys or is it younger guys that you're seeing coming in?
Yeah, it used to be people thought it was a disease of the older men, but now more and more we're seeing younger men presenting with this condition because of the obesity that we're dealing with in the younger population.
So is that the main cause, is that we're just becoming more and more unhealthy? Is that one of the causes?
That's one of the causes, actually. There are a whole host of causes. Problems with the vasculature, and in that category includes things like diabetes, high blood pressure, obesity, like I mentioned, people who smoke. All these tend to increase the risk for men to present with erectile dysfunction.
So when they have that conversation with their doctor, it really could potentially end up saving their lives because it can be indicative of some other problems.
That's actually true. Erectile dysfunction is usually a warning sign for some impending serious medical condition, especially cardiovascular disease.
Okay, so they really do need to talk to their doctor about that. Is it a treatable problem?
It's very treatable, and that is the good thing about erectile dysfunction. But if left unaddressed, it can cause a lot of emotional tolls on both the patient and the partner. But the treatments are very simple, and a lot of people, are very satisfied with the therapies.
And it sounds like the treatment option may be taking care of some of those other problems before going to things that we think of as being ED treatments.
Exactly. There are lots of conditions that could be the reversible conditions are the things that are addressed first, making sure that you stay on a healthy diet, making sure that you lose weight, you quit smoking, exercise, and physical activity, and even things like replacing hormones that some men don't have. These things can help. Sometimes it's just switching out your medications that tend to be a side effect for the erectile dysfunction.
All right, and you said it is very treatable. Is the treatment mostly just prescription medication?
We start out with prescription medications, and after that, if patients don't respond well, we go into higher tier treatments. Sometimes we have to use injection treatments. Sometimes we have to perform some surgeries.
All right, well, if you have any questions, you can talk to your general practitioner, and of course, you can always call Dr. Awane at his office and make that appointment and have that conversation and get that problem taken care of. Thanks for coming in today.
Thanks for having me.
Well, stay